I'm going to let you in on a secret approach to the hip replacement that is truly the best. I'm Dr. JD Key and this is Bone Doc Talks. Today, let's make hip replacement easy to understand. Daily in clinic, I get asked which approach to the hip is the best, and I'm going to explain this, and it may not be the one you expect. Think about driving to a friend's house. There may be 3 different roads you can take. One may be quicker, one may be a few more turns, and one may be easier depending on traffic. But they all lead to the same house, and you still end up at the same spot. Hip replacement is very similar. There are several surgical approaches, but when they're done well, they all have the same goal: less pain, better walking, better function. The 3 different approaches are posterior, lateral, and anterior. So the difference isn't where you end up, it's how you got there. The first approach is posterior approach. It's like taking the back road. The incision is made on the back of the hip. There are a few small muscles that are released and then repaired back at the end of the surgery. Because those muscles need time to heal, usually surgeons often recommend temporary hip precautions for the first several weeks or month. This has been the most commonly performed hip replacement for years and is excellent. It has excellent long-term results, is the most extensive approach, and it's great. The other approach is the lateral approach. It's like taking the side road. It's on the side of the hip. Here the surgeon comes from the side. Part of the abductor muscles, which are the ones that keep your pelvis level when you're walking, are split and then repaired at the end. Because those muscles are healing, some people notice a limp for several weeks to months. But just like the posterior approach, long-term results are excellent. Then there's the anterior approach. It's like taking the front road. Instead of cutting through the muscles, the surgery is performed through a natural interval between them. The muscles are gently moved aside and then fall back in place after. Since those muscles stay intact, many patients recover a little faster early on and often don't require hip precautions. This is the approach I use for nearly all my primary hip replacements and revisions. But if you look at everyone at a year, with an experienced surgeon and good surgery, they all do well. They end up at the same spot at the end of the year race. But the anterior approach has a head start for the first couple months due to its muscle-sparing nature, and that's exactly what the research shows. Every road has its advantages and trade-offs. The anterior approach advantages are no muscles are cut, there's lower dislocation rates, often quicker recovery, excellent access to modern technology, but it also comes with some trade-offs. It has a learning curve. It requires specialized equipment, like a table. There's a small area of numbness on the outer thigh that patients notice sometimes. No approach is perfect. Every approach has strengths. One reason I enjoy the anterior approach is how well it works with modern technology. The traction table allows me to position the leg precisely. I have fluoroscopy, which gives me real-time x-ray images in the middle of the surgery so I know exactly where everything is. That helps me optimize the implant position, your leg length, your offset, how wide it is from your hip, before the operation's even finished. Technology doesn't replace experience, it simply gives an experienced surgeon better information. So what approach is the best? And the answer is the one your surgeon performs well. Hip replacement isn't about chasing the newest road. It's about choosing the safest road with someone who travels it daily. Whether you take the back road, the side road, or the front road, the destination is the same. Less pain, better movement, better quality of life, and that's what truly matters. If you found this helpful, leave a like and subscribe for more Bone Doc Talks. And if you're considering hip replacement, visit bonedoctalks.com for more patient information and resources. And I'll see you on the next Bone Doc Talks. But until then, keep moving and grooving.